All right, we are going to unlock the mystery of sore hips, specifically tight inner thigh area. So this occupational therapy exercises should be done in the morning and before you participate in any sport. So you're going to want to use a yoga block or a book because you want to be elevated off of the floor and you want to hold on to something because we're not worried about balance right now. We're worried about form. Couple things. It is very important that when we go into the leg movements, that your upper body is not moving, that the leg that you're stabilizing on is just that completely stable, and nothing is moving in your body except for the leg that we're working on, and we're going to refer that to the floating leg. All right. Now, most importantly, the leg that we're stabilizing on, we are going to go from this to this. So it's important that we learn how to squeeze and stabilize the hip. It should be a complete straight line. The knee should be directly over the heel and aligned with the hip bone. So the first thing that we're going to do is the floating leg. We want to make sure that it is locked and our foot is in flexion. And we're going to rotate the leg. Nothing moves but the leg. And we're going to go 5 times. You ready? 1, 2, 3, 4, 5. Back to center. Center is when your knee is straight ahead. Now, we're just going to swing the leg 5 times. 1, 2, 3, 4, 5. We're using the muscles to move the leg back and forth. Now, bring the floating leg up slightly. And we're going to rotate again from the hip 5 times. 1, 2, 3, 4, 5. Lower back to starting position. And we're going to lift up the leg slightly and back to starting. 1, 2, 3, 4, 5. There should be no movement in the body at all except for the floating leg. Now we're going to lift it up a little bit higher. Do not surpass the side lift so it pushes you over. It's only a little bit. Okay, now here's the hard part. We're going to rotate that leg out again, the foot from the hip. Here we go. 1, 2, 3, 4, 5. And now we're going to go circles. The left leg is always counterclockwise. We have one more for 5. Awesome. Let's go to the other side. I got to move you over. All right. Now, it's important that we stay in our duck butt. Where's my thing? There we go. All right. Everything stays nice and rigid. We're using our wall for balance, and we're going to externally rotate the leg, not the foot. Nothing moves, just the leg. So hard flexion in the foot. 1, 2, 3, 4, 5, and back and forth. 1, 2, 3, 4. Be a coffee table. 5. Lift a little bit. 1, 2. Do not let your foot fly in. 3, 4, 5. Side. 1, 2. Don't lean. 3, 4, 5. Hold. And 1, 2, 3, 4, 5. And right legs clockwise. 1, 2, 3, 4, 5. All right. Now, that should loosen up your hip complex. Really put your legs back into proper position, and you're raring to go. Remember, stay in form. When you're doing your leg rotation, the knee begins and ends straight ahead. So don't rotate here. And we don't want any movement in the stabilizing hip, all right? This is a hard one. Stay focused. You want 5 repetitions of each movement done daily in the morning before you start your day and before you do any type of activity. All right, good luck with this one. It's a doozy, but I know you can do it.